Actually, I'm not a physician. I'm studying epidemiology, and I'm focusing on the database and the cancer trend and see how we can interpret something that beyond the understanding and see some story behind a so-called big data nowadays. So it can help the physicians to make some decisions how to use the drugs, how to plan for the future procedures. So it will be very interesting for me to keep my momentum to do more for the doctors. Yeah. Yeah. Actually, my research topic is quite common in the Western countries. We see that the aspirin shows benefit for the colorectal cancer preventions, but we also want to see whether it can also apply to our Asian population, such as in Hong Kong, because we have a huge database in Hong Kong. So we just try to utilize the details of this database and see whether we can find some similar results compared to the Western. So and also extend beyond the colorectal cancer, we see the GI-related and non-GI-related cancer. So the results quite promising that aspirin seems to show benefit for the cancers. Yeah, because aspirins relatively have a long history in Hong Kong, and we can see that, for example, we can take 15 years ago's patients and follow up them for 10 years. So we can observe the long-term effect of using the aspirin. And this is really important. We have sufficient data, we have sufficient time of follow-up. Actually, when I do the research focusing on the database, we find more than such simple questions. For example, it is feasible there may have some drug-drug interactions inside the patients. So the next step, we will do more analytics inside the database and see more complex story, and whether they take 2 or 3 more drugs and have different effects.